Hi, this is Dr. Bernadette Dulawan. I would like to share with you my inspirations for having opened this channel and my transformational transition from being a conventional doctor to a very empowered and enthusiastic functional medical practitioner. So a little bit about myself. I've been in medical practice for over 30 years now. I graduated in 1984 at the Philippines, St. Louis University, and I went back home to my hometown, a rural town where the rice terraces are in Ifugao, and worked there as one of two doctors serving 21,000 people. I enjoyed my work there. I was everything. I was the general practitioner. I was the surgeon. I was the obstetrician, gynecologist. I was the emergency doctor. Name it, I had it. I had a ball. And in 1991, my family and I, my husband with my 3 young kids, moved to Australia, where it took about another 7 years for me to fully go through my accreditation as a certified general practitioner. It was hard bringing on a family, adjusting to a new country. I almost gave up. But thanks to my husband and the support of my family, I was able to go through it all. And in my practice, I distinctly remember challenging patients who come with mostly gastrointestinal issues, tummy pains that I cannot spell, and I would send them to a specialist, and the specialist would generally work them up and do the scopes, and they come back with pretty much normal findings and say nothing is wrong, and yet the patient is not well. And those specialists and myself don't have anything to explain the patients for other than give them symptomatic relief. And that did not sit well with me. And the second experience of mine was my very own. It's close to home. My middle daughter. She suffers from chronic, almost daily migraine. And I tried, as a mother, I tried giving her what I knew, which was medications. And nothing worked. I asked my colleagues if they knew anything better. And they did give their best shot, other medications, but nothing really worked. And so I remember having known of a naturopath. I joined her in one of her consults. I was so surprised at how she was asking about food, about her gut health, correlations between food to her migraine, and giving her things. I was just so in awe. I was asking myself, how come I never thought of this? Why weren't we thought about nutrition related or causing migraine, gluten, all those things that I heard from her? This triggered my curiosity, especially so that I saw improvement in my daughter. And then comes other patients. In search and in reading, I came across concepts like leaky gut, the concept of microbiome, ecosystem in our gut. It was so amazing. I attended trainings of integrative medicine or Australasian College of Nutrition and Environmental Medicine in search of answers and more knowledge to help me out. I read more books and I came across Dr. Mark Hyman, who became my hero. He was the founder of Cleveland Clinic in the U.S. One February 2018, my husband and I were preparing to go for holidays in Tasmania. And then I was browsing through a magazine in the Institute of Functional Medicine. And hey, I saw that they are coming to Australia to give for the first time the training for functional medicine. And I said, I ran to my husband and I said, no, I'm not coming to Tasmania anymore. There is this training I really, really want to go to do in America, but they're here in Brisbane. I want to go. I registered and then I went there, and what a training. There were Australian doctors, allied health, nurses, physiotherapists, specialists, psychiatrists, gastroenterologists in the setting. They were my classmates who were also thirsting for this knowledge of functional medicine. I loved every bit of it, and I knew that I wanted to be certified as soon as I can. And voila! On Christmas Day in December 2019, I got my certification. I successfully passed the exams and became a certified functional medicine practitioner from the Institute of Functional Medicine. And I was so happy, and not just happy, but really empowered by the knowledge that I had. Gave me a new lease of life in my career as a doctor. I have the attitude now of saying, bring it on. I may not know everything, but with the knowledge I have with functional medicine, I have a platform, I have a system to deal with the patient. It's such an amazing passion I have now. I still am practicing, I'm learning my craft, and I read through my difficult cases. I see patients happy that they have found a doctor that listens to them, that finally gives time and is engaging them, and they are seeing answers for the many symptoms that they have been feeling and going to doctors for and never got some answers. And so this was the joy in my heart to have found functional medicine that has enabled me to practice medicine in a more effective way. If you understand how your diseases come about, which functional medicine has taught me, you will be empowered to be your own healer. What I have learned is genes. We are born with genes. If you are born with a certain gene that predisposes you to certain disease, it's not at all doom and gloom. This is just 20% of the effect. What actually causes this gene to be expressed or not expressed is what you do on a lifestyle, your lifestyle choices. It's your sleep, it's your diet, it's your relaxation and movement, it's your stress management or how you deal with stress, and community and relationship. 80% of these are in our hands. Can you imagine that? Our health is in our hands. It's not the doctor. It's not the pill. A pill for an ill is no longer the norm. Yes, drugs can help you, but that is not all there is. The power is in our hands. And that's why this is what enthuses me to share with you, because I believe that if we are educated in this lifestyle diseases and how it impacts on our genes and in our bodily system and how it creates diseases or prevents us from diseases, then we would be our own healers. And it's less expensive. We will live healthier lives. We are happier. We are more vibrant. It was overflowing in me to share it with you because I want us all to be healthy and vibrant. You know, when they say, can we all, getting on in years chronologically without learning, without our systems falling down through illnesses. We kind of get old, and then suddenly in our older age, we just die of old age. No chronic diseases in between. This is what we aim. And I know it's possible if only we know how diseases come about. Thank you. And bye for now. See you in the next video. We seek to educate and empower you to live healthy, vibrant lives.